right? Because there is a change in the brain also that a person goes through. Okay, because your hippocampus that has that memory store in our brains, that kinds of shrinks when a person is going through depression. Okay, so our mind, this is just some extra information, but our mind uh, they usually give those kind of signals. So our mind responds to, mm, okay, so this person needs a lot of chemical release because this person has infection in their body. So the mind or the brain, they work on infections. They will not work on anything else but infections, right? So they feel, because the symptoms are the same, right? You're not sleeping well, you're not eating well. So your mind or your brain thinks ki, oh, this is the same symptoms as a person feels when they are going through cold or when they're going through fever. So that's why your body's emotional symptoms and physical symptoms also becomes the same, just as a fever or a cold. You don't want to eat anything. You don't want to you don't want to sleep, or you're really sleeping a lot. So these are the basic symptoms that our mind and the brain also goes through, which is a very big thing. Imagine your brain is behaving the same way when they behave with a fever or a cold cough, and the same way when they behave in a depression, when a person goes through depression. So that's why. Then we have changes in appetite. Okay, so changes in appetite, weight gain or loss. Because of course you're not been eating anything. Either you eat a lot or either you don't eat at all. Then we have unexplained physical pains also, on the back or on the head, or especially on the neck area also. Digestive problems are going through. So of course there is a physical problem. So it's not as easy as just get over depression, कि आज तुम मेरे साथ drink करोगे so you'll be okay, or you'll go out so you'll be okay. It's not as easy as that. There are physical problems. There is a physical pain, and that too unexplained physical pains. Then we have the behavioral symptoms, and in behavioral symptoms, there is social withdrawal, or avoiding interactions. You don't want to be with people at that time. You don't want to socially interact with a lot of people. Difficulty in performing the daily activities, like work and hygiene and responsibility. So your life becomes dysfunctional. I always say this, a person, when they go through depression, when they go through a dysfunctional life, then that's the first ever sign that your body is giving to you, or your mind is giving to you, that you need help. Okay, for example, if your basic life, like responsibilities or work or workout or anything like that, you're not being doing that on time, so that is something, that is a very big signal from your end or from your mind, that you need help. This is not normal. Okay, this, you're not being okay. There are some days, I get that, but if there's the same symptoms are there for a longer time, then of course your brain is just like popping the same question to you, that you need help, just go and grab some help. Okay, so that's the signal for you to go and grab some help from your therapist, from a therapist, of course. Then increased use of substances, right? So any kind of alcohol or drugs or cigarettes or smoking and all of that. And of course, the very big thing, uh, the very big thing that a person is going through is the suicidal thoughts. Okay, and suicidal thoughts means, or self-harming behaviors is severe cases. Okay, and that is something that we have to look for. Okay. All right. So, when it comes to depression, then I think I've told you all about the symptoms and depression, and how depression and DBT is a very good way to cure depression, is because depression is an emotional disorder, and of course every disorder is an emotional disorder, but here there are like a lot of emotions, like a lot of, as the first symptom has said, that there is an increased level of sadness, right? So DBT has been adapted to treat depression. Then particularly in cases, okay, when we did DBT with our patients, where the traditional therapies have been less effective, so we have done DBT with them, okay, where there is mindfulness involved in it, where there is emotion regulation involved in it. And components of DBT, as we have already discussed, the different kinds of therapies inside DBT that we have to inculcate for the therapies, so mindfulness, emotional regulation, we have we have to make the person, the client, more emotionally, they have to communicate their emotions a lot more, okay, rather than just emotional regulation. But emotional regulation is nothing but the dysregulated emotions को regulate करना is just that. ओके, एंड एज आई सेड, जब आपकी लाइफ डिसफंक्शनल हो जाती है, जब आप बात नहीं कर पाते हो या कुछ, उसी को रेगुलेट जब करते हैं, तो लाइफ एकदम, मतलब आफ्टर थेरेपी इट बिकम्स क्वाइट नॉर्मल, and of course there are a lot of things that you have learned during therapy that you inculcate in your life, like journaling you have inculcated, or speaking to certain friends, or being in a support group is something that will help you to talk things, talk to other people also, and talk a lot more. Okay. So, in managing depressive symptoms and preventing relapses. All right. So this is what depression and DBT is known for, which is disorders, the different kinds of disorders. First is, of course, depression, and we talked about all the symptoms of depression. And then DBT कैसे मदद करता है डिप्रेशन को ठीक करने में, ठीक है? सो फर्स्ट इमेजिन द पर्सन इज गोइंग थ्रू, ऑफ कोर्स, अ वेरी बिग turmoil in their life, right? But through DBT or emotional regulation or mindfulness, first of all, they'd be mindful about what is the emotion, or what is the symptoms that are going through in their body, okay? Because there is a lot of problems which a person goes through because they don't have those kind of skill set. So a therapist gives you that kind of skill set, वो आपको इतनी motivation देते हैं, the therapist, and I'm not talking about जैसे हम TED Talks में सुनते हैं वो वाली motivation नहीं, but वो TED Talk तक सुनना भी is something that your therapist will guide you to do it, you know um एंड वो आपको जर्नलिंग बताते हैं, अगर ज़्यादा मेजर है डिप्रेशन या मेजर डिप्रेसिव डिसऑर्डर है, तो आपको मेडिसिन के थ्रू भी वो ठीक करते हैं, ठीक है? देन टॉकिंग टू अदर पीपल और राइटिंग थिंग्स डाउन, लेटर्स डाउन, अदर एक्टिविटीज to do in therapies, okay, like hypnotherapy also really helps in all of that. All right. So, because of these DBT, different kinds of therapies into DBT, so this is a very major. Then DBT के थ्रू बहुत चीजें in depressive disorder solve हो जाती है. All right.